Welcome to the Tech Report podcast, where we help businesses survive, thrive, and create value.
Well, welcome everybody to the Tech Report, the podcast that is all about helping businesses survive, thrive, and create value, especially in our trying environment today. And I'm your host, Brad Stoller. Well, today, as we're recording this podcast, the world is slowly getting back to business. We do have a long way to go, but we're moving. So I just read a report yesterday stating that at least 1/3 of all people who filed unemployment claims have not received any funds yet. Even though we're starting to get back on, we have some people that never received a dime and they're hurting bad. We also just went through rioting across the world for social injustice and racism. People are just simply fed up and full of anger, anxiety, stress, depression. Many are just simply having a tough time coping with everything that's going on in the world. So many of these people are going to end up turning to drugs and alcohol as a way of surviving, the pressures of their world. Many people are simply afraid to go back to work because they feel unsafe in their workplaces. I recall hearing people who worked at meat packing plants and how scared they were to be shoulder to shoulder with their fellow workers, and how many COVID cases and deaths were attributed, to the meat packing industry. So while our country is greatly improving the COVID numbers, and we are, but there's still a lot of stressed out people out there. And we haven't even started on the frontline workers that had to handle all the COVID cases in the ERs. So alcohol, drugs, suicides, they're all on the rise, and it's going to be affecting businesses of all kinds for a long time to come. So luckily, there is a shimmering of light. There are some dedicated people out there who are trying to help others and make a difference one life at a time. So today, I am honored to have one of those dedicated professionals who's doing just a simply fantastic job helping others. So our guest today is a Florida Board Certified Addictions Professional, otherwise known as a CAP, internationally certified alcohol and drug counselor. He's a certified health coach, an approved training provider with the Florida Certification Board. He's a member of the Florida Association and National Association of Drug Court Professionals. Hang on a second, I gotta get to my breath. I still have some more to go. He is chair of the Florida Association of Recovery Residences, otherwise known as FAR. And he's also a board member with the Alliance for Addiction Stimulus. He has previous experience as the executive director of residential substance abuse treatment centers in Florida. And he served on the board of several homeless coalitions and other community organizations. He's worked extensively with the homeless, addicted, mentally ill, sexually abused, and persons with disabilities. From a business perspective, he has been an owner, CEO, and founder of several treatment centers. And on top of all that, just a good guy, and he's also a pastor. So let's end the suspense. Our guest today is Lyle Fried. Lyle, welcome to the podcast.
Oh, thank you very much. Happy to be here.
Well, Lyle, I tried to mention a few things, and you and I talked. I don't even have time to go over all the credentials you have. You've done a lot of things, and you are doing a lot of things, and you've been involved with. So tell us how you ended up being involved in the behavioral health area, and what are you up to today?
Well, sure. I came by it through experience. I was a business owner in the 80s, and through that, made a lot of money and made poor choices with it, and ended up needing some treatment myself. So that's what got me interested. And so as I was in treatment, I ended up giving my current company at the time to the employees, and decided to change gears and start working toward that. So I went back to school. I found that my faith happened to be pivotal in my experience in changing the way I viewed things and the ability to live healthier. So I went back in seminary and became a pastor, and I understood there was a lot more to it than that. So I went back to school and got a psych degree, and then got another psych degree, and then did some work, continued to this day to be learning all the time. To me, that's my new drug, quite frankly, is knowledge.
Yeah,
and so
exactly.
learning how to do business, learning how to help other people, it's just it's been very rewarding and very fulfilling. Sometimes profitable, sometimes not as much, depending on. I worked in nonprofit for a good bit of that. As you mentioned, working with the homeless is never going to be profitable, but I've had some other businesses that have done very well. So it's finding that balance has been the key for me.
Exactly. You said not profitable, but hey, profit comes in many different forms. And if you're
Yes,
helping some
yeah,
people, you may not financially be profitable, but man, if you're making a difference in somebody's life, that is, I don't know how you can put a dollar figure on that. So,
yeah.
before we go any farther, just hats off to what you've done and your commitment and passion for what you do. So,
Thank
but
you.
I know you've devoted your life to the addiction and mental care areas. You've done a lot of things, and I didn't even mention that you work in Haiti, I believe it is. And I mean, you're all over the place.
Yeah.
But what are you seeing as results of COVID-19? Are people really struggling more than before the pandemic started? You're in a
Absolutely.
position to see that. So what's going on out there?
Yeah, so, and there's a few factors involved here. So one of the things I do is I work for a program called Help for Our Heroes that specifically looks at veterans and first responders. And you can see just from looking at the news today, the added pressures on first responders, and that includes emergency management people, dispatch, hospital frontline workers, obviously law enforcement, fire rescue. Their life has changed dramatically in the last several months.
Well, that's for sure.
The requirements on them, the concerns on them, their family is now isolated, and it's just, it's really put a strain. But on the general population, excuse me, we're seeing exponential increase in reports of domestic violence, child abuse, anxiety and depression. There was just a report out, an article out, I believe yesterday or day before, from a medical journal about the shortages in some of the psychotropic meds. There's so many people looking for a solution to their new experiences with depression and anxiety that the pharmacies are running out of medications for it. So there's no doubt that it's on the rise. Some of that is the isolation issue. We are social creatures. So the need to interact with others and the inability to do that for some people. Now there are others who part of their illness is that they isolate. So not having to go to work, not having to interact with other individuals has taken a pre-existing condition and made it worse, because one of the things that got them out of that is, again, the movement. So if you suffer from depression, physical activity, even just walking, can help alleviate some of the symptoms. When you cut out the ability to do that, those symptoms brew, if you will, and simply worsen. So we're definitely seeing a rise on that. And then when you talk about with the people with alcohol or other substance abuse issues, a lot of them depend on community support groups, AA, NA, Celebrate Recovery, et cetera. And when you take the ability to meet in person away, that support system, even if you're doing it virtual, it's not the same for many people.
Exactly.
So a lot of people who relied on that system found that their supports were gone. And if they were particularly early in the process and they needed that even more, then obviously they're at high risk. And we're seeing a lot of calls related to that.
Yeah, exactly. So, well, I know on a personal level that, hey, my wife says she loves me and everything, and she loves me being home. But after a while, I think I'm getting the idea. Say, hey, would you leave me alone? So, okay, I get it on a small scale, but I'm very fortunate to have somebody who could put up with me, I guess.
There
But
you go.
but how you mentioned everything's on the rise and all the reasons, and it makes a lot of sense. But how is this increase, addictions, suicide rates, and just anxiety and general, how is this affecting businesses as they're trying to reopen?
Yeah, I wrote an article, I think it was last week, maybe the week before, on returning to work in COVID and how that works with mental health and the things you have to do. So certainly businesses need to be prepared to understand that there's an adjustment period, how to help these people understand what they're going to experience, particularly, again, some of these people had underlying conditions that they've managed and found patterns to live through them or live with them that have been taken away. And now they've got to relearn that. It takes us a while to learn things. It doesn't take us long to unlearn them.
Yes.
So understanding that, and then of course in the business realm, how do you do that? One of the things that they're recommending with the CDC recommendations is to remove the communal areas. no more break rooms, and
Right.
these kind of things. So how do you maintain that social culture within your business to keep it healthy? Because that is part of the healthy work environment, right? We know
Exactly.
that if we lose these people, and some of them we may lose to some of these situations. So understanding that, making your HR department, your EAPs friendly to this, letting the employees know what options they have that are healthy. Because let's face it, if we can get them some easy work, I'm working with a group now to provide telemed to employees simply because we want them to have the option to pick up a phone call, get the help they need, whether it be psychiatric prescriptions or just a counseling session to air it out. And if we can do it easily over the phone during these restricted movement times, we can keep a healthy workforce. If we don't know what those tools are, we can't provide them to our employees.
Yeah, exactly. Well, I will say telemedicine, I actually, well, I burnt my arm not too long ago. So rather than going to the doctor's office, we just did a nice telemed appointment, and hey, it worked out pretty well. I actually prefer it. I didn't have to, take an hour and a half to 2 hours out of my day just to go have them take a look and say, hey, put some cream on it. That's basically all it was. So it works very well. And it's good to hear that we'll be able to use this, for, the, to get people back, good emotional status as well. So we mentioned employees, and they're going to have maybe some of them are going to have some tough times transitioning back. But what can business owners actually do to be proactive about helping their employees? As we're transitioning back to, I guess, normal, whatever that means. And why do you feel that there may need to be some adjusting on the business's part as people come back? But what can they be doing to help?
Again, just an understanding of what they're experiencing and helping them understand it. So when I wrote that article, the city I live in put it out in their city newsletter to their 1,200 plus employees and family members. That's 1,200 employees plus then their family members are
Their families,
beyond that. So giving them that information, helping them understand what the healthy alternatives are, what they're experiencing is normal. There's one of the biggest barriers to mental health issues is the stigma. We've got a stigma. It's one of the last stigmas remaining, and there's a few out there, but this is a strong one, is that we don't talk about mental health. I'm a Rotarian as well, and I was speaking with a large group of Rotarians and on mental health, and I asked them to raise their hand if they or someone in their immediate family had ever experienced a mental health situation or mental health issue. And out of this huge room, one hand went up.
Oh my.
And I said, well, one of you is honest and educated. The rest of you are not one of those. You're either not educated, because here's the trick. Anxiety is a normal experience. It's actually a healthy experience in some environments. Imagine if you're walking down the Appalachian Trail and a bear starts charging at you. You had better have a certain level of fear and anxiety, right?
Exactly.
So depression is a normal thing that people go through. Now, there's a difference between clinical depression, being clinically depressed, and experiencing a depressive mode. So, but the fact that nobody wanted to raise their hand points out that stigma issue. The fact that it's still those things we don't talk about. So I think someone at the top talking about it. I spoke at a church on this recently, and the pastor got up and said, listen, I take medication for my depression. His church needed to hear that, because many of them will sit there and pretend that they're not experiencing it and pretend that life is wonderful, and that is only going to make it worse. So the ability from the higher ups to say, we know this is an issue. We understand everybody has these moments, some worse than others. We're here for you. We understand it, and there's options. So that buy-in from the fact that it exists, the ability to speak about it openly from the top down, allows those people to then go get the help they need when it's needed and before it becomes completely debilitating. We all know it's better to triage our employees and give them this level of help before they sink down to a level that's not repairable and we lose the employee. Or worse, I mean, certainly we've seen the explosive nature of some of these things when they go unaddressed.
Yeah, exactly. And and I know you and I had talked about this last time we had spoken, but from a cost standpoint, why on earth would it make sense to have awareness and programs to help employees get treatment? Why not just replace the worker with just someone else? Like the old days, hey, you're not here, you're gone. Let's get somebody else in here. Why not? Why not have that type of an attitude versus trying to help them through, even if it means sending them home and recovering for a little while. I mean, from a
Yeah,
cost
and
standpoint.
I speak at conferences quite a bit, and EAPs are one of them, and there's a lot of large employers that come in, and many of them get it. So just stress alone and the related anxieties to it. So even financial education. One of the biggest stressors we have is financial insecurity, particularly today, right? So
Right.
just the ability to talk about that and talk about options is significant. And so the advantage from a financial standpoint as an employer and someone who's employed quite a few number of people at a time, I can see that if I can help them with this, quite frankly, a minimal effort, then I can save them from those stress levels that can take them out. And so one day at home or one day off speaking to a counselor, or even quite frankly, 2 weeks to a month if they have severe issues to get reset and be healthy for the rest of their life is a lot cheaper than all the added up days they're going to lose from not making it, all the other physical health symptoms that can be generated from unaddressed anxiety and depression. Because here's what happens, both of those psychological symptoms lead into physical symptoms and are more lost time at work. We all know what more lost time does to us. And then, of course, there's the cost of training new employees. We know that it's cheaper to retain than retrain and train new employees to come in. So we've done the cost benefit analysis, and we know that this is the cheaper route and the more efficient route and the healthier route for the whole. Because really, mental illness and mental well-being are both things that can spread. In other words, one person filled with anxiety can create anxiety in others. One person in stress mode can affect the rest of the workforce. Whereas a healthy person can also have that positive impact. We call it the bombshell theory, that what I can't change you, but how I react and how I behave can affect you to where you can create change, positive or negative. So healthy individuals create healthy individuals.
Exactly. So you were talking about, it's funny because my wife and I were just talking about this not too long ago, but there's some people out there that right now that when I was out just yesterday, I noticed that I went to pick up some supplies and at the grocery store, okay, so everybody's wearing their mask. They get in the car. In fact, a lot of them are wearing their mask while they're still in the car. As soon as they get out, mask goes on. They start walking to the store. They have it on the whole time. And I noticed that while I'm in the store, even some people, I do the grocery shopping right now, so I'm the dedicated shopper, if you will. But I'm going down the aisles, and I noticed that some people are really, really squeamish about me approaching with a cart if they're like stopped and looking at something. Yeah. And I can tell they don't want me to pass them. They don't want me to come near them. And okay, so I'll stick around and just wait till they're ready. Okay, but others. I went to the local Home Depot, for example, and sure enough, I mean, people, you could just feel it. Half the people there, they didn't care about wearing a mask or not. They think it's stupid. And so we have a lot of different attitudes towards what's going on right now, which for that person in the grocery store, me coming up behind them, if it was one of those people that, think that the COVID thing's just a fluke anyhow, and they keep getting too close to them. Now that creates a lot of stress, doesn't it? Mm-hmm. So back to the workforce, those people who are, businesses are starting up right now in the state of Pennsylvania where I'm at. Hey, tomorrow's a big day because we're going green. Everybody's opening again, kind of. But there's a lot of stress for those people that really are thinking that, hey, whoa, there is just no way I want to catch this. I've got a health issue. I've got asthma, whatever it may be. Please stay away from me. That's a lot of anxiety. And then you get to somebody out there that's thinking it's just a fluke, and they're not really being how's the word I'm looking for? They're not really considering the other people, I guess, so much and their feelings. So there's a lot of stress out there. So how is that person that's really, really scared about what's going on? Should they be this scared, or should they back off a little bit? And the people who are not concerned at all, maybe they should be a little more scared. Well, how do you kind of work with those people as an employer? You got all sorts of people like that. So
for the employer, first of all, the question isn't whether they should be scared or not, because you're not going to, what they are or they aren't. You know what I mean? So,
right,
so the question really shouldn't be, should they be scared, but how do I mitigate this as much as possible? And the answer to that is simply to have clear pre-return instructions. If they're already there, then make it clear. What are the expectations? What are we doing to protect our employees? What are the new policies that we put in place to keep us sanitary? Is there a cleaning crew that's going to come around? Are we supplying masks? Is there a break room area or not? How many people are allowed in at a time? Whatever you set up, safety features in your facility, in your work environment, you need to make sure that's clearly communicated to put them at ease and help them know. And so knowing that you've done something will ease them somewhat. Seeing that it's done well and that it's well regarded and well informed will help them even further. So they may still be timid, and there are some people who are high risk that are like, I'm just, you know what, I don't need work as much as I need my health, and I'm not going to go back to work. And there's nothing you can do about that. But again, the better planning and the better communication you have about that planning, the more you can mitigate that fear factor. And then also that helps because then the other employees also understand they have a role and responsibility. Whether they buy into it's needed or not, it's a policy. And like any company policy, you may have a policy that I have to check out and go home by 5, whether I'm done working or not. And that's it, you're cut off. Whereas I'm one of those guys who just suddenly I realize a few hours have gone by. Well, that's a policy. I may not agree with it, I may not like it, but it's a policy and I've got to abide by it. So that also helps by having those other people in line and understanding what the rules are. They're able to perform accordingly and therefore also mitigate some of the fear factor on the other end.
That sounds good. So there's just a lot to cover on this. There really is. And you and I were kind of joking around. It could take us 3, 4, 5, 6. We could just have a weekly segment and probably still not cover everything. But I know we really have covered quite a bit here today. And I'm really hoping that your episode is going to help employers understand the importance of helping their employees. What else is really important for business owners and managers to know? Lyle, what have we missed talking about that you feel is important so far?
Again, the talking about it is good, but then understanding what the options are, understanding what the employee rights are, and helping them understand that too. Because again, if you show that you are favorable toward it, that you understand FMLA, if you understand the privacy of, if they go to get help somewhere and not being stigmatized, not being punished for it when they get back, which is illegal, but still happens. But if you have a healthy employer, they'll understand that and they'll encourage their employees to get the help they need before it becomes more severe. The sooner we address any of these issues, the less damage done to the individual and to the company. So I think that it's understanding that, but also have some alliances. Understand, what insurance do you have? Where can they go to get the help? If it's an EAP, who do they work with? Who don't they work with? Are there options wide open? And maybe reach out. I have contacts across the country. If somebody ever wanted to reach out to me and ask, what are the good resources for prevention, for treatment, for mental health, for substance use, whatever it may be, I'm happy to help. There's no need for it to become worse. Again, all of these are treatable situations and symptoms, right? They're all, and many of them are preventable. So if we help them understand the resources that are available, and even just if you have a company e-newsletter, making that a part of your e-newsletter, give them the information, let them know that, hey, we understand this. This is an issue. It's real. The percentage of people in the last survey who have anxiety about their finances or about relationships at home or about how they interact with their coworkers or job security is almost everyone. I mean, it's so prevalent and we act as though it's not there. Whereas if we talk about it, even that alone eases a lot of it. So we can do a lot more than we're doing corporately.
Yep. I agree with that a lot. So, my guess is that employers listening to this are going to have a few questions. And you mentioned, resources. There's a lot of resources out there. A lot of them they don't even know where to start. So how do they get more information, and how do they contact you? And also from a geographic standpoint, where all do you serve? Right? Is it total across the country, the world, just Florida? Where all do you help people?
Yeah, I work with people around the world, mostly the U.S. But I've helped people, and I actually next week flying out to help a family. So there's no geographic restriction. The resources available to them may vary on region, and of course, for their employees, it may vary on payment method as well. Whether they're going to use insurance or cash or
Right.
whether it's for them or an adolescent member of the family. There's some differences. The best thing I can say is each person is different. And if they call me, there's no charge for me to lead them to what is the best resource for them. And that will depend on the individual's situation. And if they're looking for corporate resources, I have those as well. And so quite frankly, I'm available. It's become a passion of mine, obviously. So I have no problem assisting others in finding those resources. And they can call me directly on my cell phone. I don't know if you want to put that up with the podcast, or you want me to just tell it out there?
Well, I tell you, I'll make sure that it's on there so people they'll have your number if that's okay with you, and
Sure.
That way they'll just have to read through. But is there a website or anything like that they should go to, or just call you directly, or what is the best way for them to?
Well, they can call me directly, because depending on what their needs are as to which websites I direct them to,
Okay.
I can shoot you an email with some favorite websites. I can shoot you that. I'll give you a couple. One again for the veterans and first responders, which is a particular interest of mine, and then one for the general public, and then one for Florida specific, particularly for telemed. And then if they are looking for something other than those, they'll have to call me for those. But I'll shoot you an email with those on there.
Sounds good. I had a feeling you're going to say that I have more than one website. Because I just know your background, and it's a mess. One website is not going to put everything in there. I get it. So.
Well, I want them to get directly to the information. They can get to all of it, but I'd rather them have the information that they need directly to what's pertinent to them. So.
Yep, exactly. So, well, once again, a special thanks to Lyle Fried for his dedication to helping others. I really hope that business owners and managers will be able to be more knowledgeable and aware of what their employers are going through, and really some steps that they can do to help. So Lyle, again, just a huge thanks for being with us here today.
All right, my pleasure. Anytime.